What's up, you guys? My name is Miguel, fellow Xray Tech peep here, giving you some X-ray knowledge. Today, we're covering X-ray Tech jobs versus nursing jobs. Now, once again, I'm an X-ray Tech. My lady, she's a nurse, so I can kind of give you the runaround on both of the worlds. So, as far as jobs goes, there's way more positions or departments or places you can work as a nurse. As far as clinic goes, hospital goes, retirement home, there's way more jobs available for nurses. I will give them that. Because ours, we're kind of limited to, you can do travel, you can do ER, you can do some of the clinics, like private clinics. You can do the main radiology, you can do outpatients, you can kind of do like orthopedic, kind of like slightly more limited, because like let's just say let's just take the ER for example. In the ER, let's use mine example, there's only 2 X-ray techs a night for the whole hospital. Compared to nurse, in the ER there is between like 8 to 10 nurses in the ER. Sometimes even more, depending how bad it is. So you can see how, as far as job wise, more competition. So, and as far as like day to day stuff, okay, we'll take charting, for example. My lady complains about how much stuff they have to chart, how much stuff they have to bill, the notes, if the patient falls, so many details to cover their butt. And then she's like, one day she asked me, so Miguel, what do you have to chart? And I'm like, really, we really don't chart that much. Like, if we x-ray someone and the x-ray doesn't come out as good, in our little notes we put unable to take proper image because patient incompliant or patient was in pain or broke or was too hurt. And then we'll put, let's say if it's a chest x-ray, we'll put our prior chest x-ray was on blank or prior KUB was on blank and you initial it, or patient was shielded. If you're in the main x-ray and you gave some sort of contrast or stuff like that, you'll put in there how much contrast you gave and stuff like that. That's really about, or if the patient was like violent, stuff like that, you put in your little notes, or the charge to bill for the contrast, or to adjust for the how many views you took. That's really about it. We don't really. They have way more stuff than we do. And let's say, as far as patient care goes, guys, we literally will bring them in. If you do a chest X-ray, one view. If they're in good conditions, you literally maybe ask them what happens, get their name, date of birth, lean them forward, slide the board. Tell them to take a deep breath in, shoot it, ask them if they need a blanket or anything like that, and you're literally on your way. Maybe 2 minutes, 1 minute if you like speed run it, like per patient. Meanwhile, nurses will come in and they have to, if they're in pain, give them drugs, IV, stick them, make sure they're comfortable, talk to them, they have so much more stuff, way more. So sometimes my wife will get mad. She's like, literally, you just come in, slide your little board, give them like some instruction, you shoot it, and then just walk out. And I was like, yep, you bet. So they think we're button pushers. I'm like, and I make more money than you, way less responsibility. Which, certain nurses will make more. If you have like RN, or BSRN, they will make more money than, we do. But for the amount of responsibilities, I'd be like, nah, pass on that. And then let's see, as far as traumas, also same thing. They will be doing so much stuff, and we go in there with a little board, shoot it, come back out. Kind of makes them mad sometimes because they were like, okay, we did our job, and they're being there stressed, doing so much stuff, and it's a lot. I'm not gonna lie to you. For me personally, from what I've seen, I think we almost have one of the most easiest jobs as far as the medical field compared to like being a nurse, being other stuff. Kind of easy, not gonna lie. I mean, it's not always easy. I mean, there's stuff, if you gotta do fluoro enema, sometimes they're in pain. I mean, but